This is Doug Field, CEO of the Institute for Healthcare Consumerism, along with my co-host Brent Macy, and welcome back to the segment of Healthcare Consumerism Radio. We're going to have a continued discussion on the various different moving parts of healthcare consumers, and one of those is healthcare access and the emerging on-site clinic business. And joining us to talk about what they're doing is Dr. Jeff Wells, founder of OurHealth. Jeff, good morning.
Hey, good morning. Thanks.
Hey, good to have you on the program. You're coming to us from Indianapolis?
That's correct.
Yeah, I'm a Buckeye boy that's moved down here to Atlanta, so I'm a Midwesterner, so good to have you on the program.
Yeah, no, it's always wonderful to have some fellow Midwesterners throughout the country there.
Hey, Jeff, talk to us about OurHealth. Give our audience a little background on OurHealth, and then we'll get into some of the specifics.
Yeah, I would be happy to. So OurHealth is an integrated provider of on-site healthcare services for employer groups. And so what that means is we'll actually go into large employers. They could be manufacturing or financial services, technology companies, et cetera. And we'll set up a primary care clinic for their employees and family members and provide a whole host of both primary care and wellness services to help improve the health of their employee base, as well as help both the individuals and companies lower their health care costs.
Any specific size employer that you work with? I mean, is it 1,000 up? You know, what's your typical size employer group?
Yeah, I'd say across our client base, the average size is going to be north of 1,000 employees, but it's variable. And we work with groups that may have only a few hundred employees. And actually, just recently, we've embarked on a new strategy to help partner with even smaller organizations by combining scale. And in the Indianapolis area, we're piloting a solution where we've opened a network of clinics throughout the city, and then employers have the ability to join that network. And so while it may not be a facility that's located on their premises, for both the employees and then their family members, they could have access to up to 7 clinic locations, and they don't. You know, the company then does not have to bear the full investment of building out a brick-and-mortar clinic. And so thus far, that's been going phenomenally well, and we're really excited about the future prospects of that.
Yeah, I actually read my mind, Jeff. I was about to ask you about the emerging, what I call near-site clinic market, and that's exactly what you're outlining, that you guys are involved in that part of the space as well. We see that happening across the country at a pretty rapid pace right now.
No, I think that's right. Yeah, we as well recognize that, you know, there are a good number of very large employers that have the scale and the sophistication, and it makes economic sense to do something, but there's so many more organizations that are smaller that still want to realize, you know, the same benefits of, you know, better access to, you know, high-quality care with a consumer-directed model that can help patients, you know, better navigate the complex healthcare system.
Sure. Where is telehealth? Is telehealth integrated in part of your model as well?
Yeah, I would say that that's still an emerging component to it. So we do have an online health portal or a web portal for our entire patient base that can access for, you know, scheduling appointments, communicating with their provider, you know, working with a health coach and some wellness programs. We're currently exploring expanding beyond that and evaluating, you know, really more the telehealth solutions where, you know, through a website or through the telephone, you could actually engage more broadly with a healthcare encounter. And I think that we've seen a lot of activity over the last 12 months in that area and are closely evaluating what the best way is to take advantage of that.
Hey, Jeff, this is Brent. A quick question. When you were looking at, you know, the space and developing your model, what were some of the, you know, the trends that led you to do what you're doing, and was the healthcare law, was that a driver to continue to develop what you're doing?
Yeah, Brent, good question. So, you know, at the beginning, if we look at some of the macro trends that I think have, you know, enabled the fast growth of both our organization and others that are doing similar things throughout the country, you know, one would be that which is really a, you know, multiple decade-long trend of the U.S. economy being more based upon knowledge workers, where sort of the value of human capital for a given organization in a global economy becomes more and more important. And so then looking at really the health and the burden of chronic conditions, you know, how that's impacting productivity has become more and more apparent, you know, I think to employers. Secondly, I think just the ever-increasing rate of healthcare cost growth across the country is really putting pressure on employers to be much more, proactive in what they are doing to manage their healthcare spend. And then I would say, to your point, we started the company in 2009, so really kind of leading up before the Affordable Care Act was passed. But I would say, it has actually been helpful to the growth of our organization in the sense that at least, early on, there's a lot of elements out of the Affordable Care Act that are leading to upward price pressure in the healthcare market more broadly. And so I think employers, while there was some initial uncertainty, as the law was being passed and then what it might mean, there's a little more clarity, and most employers see a lot of risk with their healthcare cost increasing, short of doing something more proactive. And so it's actually been helpful to us in the sense that more employers are now proactively reaching out to OurHealth to ask how we can be a helpful partner.
Now, most of these employers that are reaching out, are you seeing them with higher deductible type plans, or are you seeing them with some cost exposures and therefore saying, hey, we need your piece of the puzzle because of what it can do to impact the health and healthcare spending of our employee population?
Yeah, I think that's right. So, the OurHealth solution can work with a variety of different benefit designs. But you're right. More and more, we're seeing employers continue to migrate to more of a consumer-directed health plan design. So the deductibles are a bit higher, and they're getting more and more engagement and accountability on the part of their employee base and those family members. But I think the real challenge historically has been if you just give the employees the financial exposure, but not a lot of tools to figure out how to be healthier and where to access care and how to be smart about making your decisions, you're setting people up a little bit for failure. And so what we're seeing is, OurHealth is an entirely independent organization. We're not affiliated or owned to any health system or health insurance company or, imaging center pharmacy chain. So we feel like we can be a really good unbiased partner and advocate working with the patient. So when they do have, an economic incentive to ask more questions about future care, if I need to have an MRI done or a colonoscopy, done, hey, where, doc, where in town should I be going? And what we've done is actually centralized a referral operations, what we call a value-based referral guidance approach, where we'll partner with a patient and kind of help them, kind of make those decisions. And so they're more effectively able to be value-conscious consumers. And
that's one of the things that really separates you from some of the other, options that are out there from a near-site, on-site type clinic in the market?
It is.
Yeah, okay.
Hey, Jeff, talk about the whole wellness and even helping the chronic care patients better manage their conditions, because I think that's a whole side that's emerged from on-site clinics, really, helping that wellness engagement, helping those with chronic conditions manage those conditions better. Talk a little bit about that.
Yeah, sure, Doug. I mean, that's a great point. So, when we look at a given organization, what you find is that, healthcare issues or healthcare conditions are not distributed evenly. So, there may be, a smaller percentage of people that are really dealing with some chronic issues, whether it be high blood pressure, anxiety or depression, asthma or emphysema type issues, that really need a little higher level of engagement and support to work through, making some change to make sure they're on the right medications, have access to all the right treatments and so forth. And so that's really a core part of our model as well, not only helping people be better consumers about making decisions, but really to even be, I think, more conscious of managing their own health from a lifestyle perspective. And so we have both really talented, primary care physicians, nurse practitioners, or physician assistants, but then also health coaches that are really part of our team. And they will work with individuals on everything from weight management and nutrition to dealing with stress and thinking through how to put a game plan together for things like smoking cessation or managing diabetes and so forth.
Now, are you connecting with employers via your own team, or do you work through brokers? What's your model for getting in contact with key employers that may need your service?
Yeah, it'll be a little bit of both. I'd say primarily we'll work through the broker channel. So there's really good benefit advisors that are helping employers think about, the complex decisions and how to put together an integrated strategy to be successful. And we found that partnering with the talented brokers or the benefit consultants has been a really helpful way to get us both exposed to employers, but also tie in the right pieces together to make sure that the incentives, in the way that the benefits are designed, are kind of aligned with maybe other programs in place, and then the OurHealth solution.
Jeff, if you were to look kind of 5 to 7 years down the road, where do you see your piece continuing to evolve for employers?
Yeah, so I think probably some of the biggest areas are continuing to invest and develop some of our data analysis capabilities to make sure that we are engaging the right people at the right time to help ensure that they're staying healthy and avoiding issues that lead to time off of work and lead to expensive healthcare utilization. So that's one area. I think another is really about just continuing to leverage technology in ways to make it more accessible and more convenient for patients to partner with us and with our providers. The historical model of healthcare, as we all know, it's sort of where maybe financial services was 2 decades ago, where to deposit money or to get money out of your account, you had to go into a brick and mortar bank and meet with a teller. Healthcare, today it's still very much sort of having to get up and go to the clinic, have a conversation, then maybe leave and so forth. And so we're looking at ways, again, through technological solutions to help make it just more convenient and enable us to be more responsive to patient needs.
Now, let our audience, and we really appreciate you coming on the program today, Jeff, let our audience know how they can find you, either if they're a broker, employer, or a consultant out there.
Yeah, no, I appreciate it, and thanks again for the invitation. Probably the best place would be our website, www.ourhealth, which is OurHealth.org, ourhealth.org.
Hey, Jeff, really appreciate it. Have a great weekend, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.